Our bodies are telling us stuff all the time. The question is, how often do we actually listen? Welcome to South Bay Sunday. I am your host, Sandy. With me today are Jon Jardine, a stage 4 kidney cancer survivor, which probably sounds cool to hear that out loud.
It does.
And Brian Hopkins, a doctor at Pacific Urology in Walnut Creek, who actually helped Jon with his treatment process. Thank you both for being here.
Thank you.
First and foremost, I know you're busy.
You're welcome. It's a pleasure to be here.
And you also are co-workers. That's why this is a crazy story, right?
Ironically, we are.
Yes. Now, Pacific Urology, I had to ask him, what exactly is urology?
Well, urology takes care of the medical and surgical issues regarding the genitourinary organs, which are the kidney, the bladder, the prostate, and reproductive organs in some cases with women and also men.
So all the stuff you can't see.
That's right.
Because you were diagnosed by accident.
Actually, it was kind of by accident.
Kind of, right? So you had, what were your symptoms at first that kind of got you thinking, what is going on with my body?
Yeah, the predominant one was I've been pretty steadily from a weight standpoint, for the last 20 years. And I noticed a decrease in weight. I was weighing about 209, and I got down to about 190, and then I got down to about 197. And I also had a...
And you weren't actively trying to lose weight?
Not absolutely. I worked out regularly, about 3 days a week, and I get some cardiovascular exercise a couple days a week as well. So I felt I was in fairly decent shape. I'm a fairly healthy eater. I don't eat a lot of junk foods. Eat a lot of fruits and vegetables and stuff of that nature. But I went in for a physical in May a year ago, 2009, and through that physical, all the blood tests, all the results came back very positive. Cholesterol levels were good. Everything else was very positive. I indicated to my primary care physician at that time that, I was a little concerned about the weight loss, a little bit of fatigue.
How long did it take for you to lose the weight?
It probably happened over about a 4-month period,
okay.
4 or 5 month period.
Okay, but yeah, that is alarming if you're not actively trying.
Absolutely, yeah. And so
for women, that's a blessing. But in this case, no. This is something.
Jon had what we call an involuntary weight loss.
Yeah,
that's
involuntary.
Right. That's right.
That's the medical term for it. So it's a concerning warning sign.
So I mentioned that to my primary care physician, and she said, "Well, if you have any additional weight loss, let me know, and we'll do some further tests." Sure enough, about 2 or 3 weeks later, I lost a couple more pounds. So I did go back in. We took some additional tests, and those tests came out positive as well. I mentioned that my cough was getting progressively worse. And again, it wasn't like I was hacking up a lung or anything of that nature, but I was coughing, frequently several times during the day.
Did you think it was a cold at first?
Well, not to last as long as it has been. Intuitively, I thought there was something wrong, but I really couldn't put my finger on what it was because I'm pretty aware of my body signs and what's going on, and to have a weight loss and the cough wasn't natural for me.
Yeah.
So at that point, she said, well, because of the cough, let's get a chest x-ray. So I went in and got a chest x-ray, and the chest x-ray revealed numerous nodules throughout my chest, which wasn't a positive sign. At that point, I'd consulted with Dr. Hopkins to kind of find out what his thoughts were along the lines with what was going on. He had indicated at that point that we needed to get into a CAT scan because it didn't appear that that's where the masses had started from, but that it may have metastasized or grown into my chest.
So the CAT scan is like a step up from an x-ray, right?
Well, it's a special type of x-ray. And so Jon came to me with this, and he showed me this chest x-ray, and it was very concerning looking. Innumerable, what we call masses in the lungs, looked like a snowstorm. Just blotted everywhere with tumors. And it was very clear to me at that time that there was something very wrong, especially when he shared with me his history of weight loss and a cough. And so I did recommend that he have a CT scan. I sort of facilitated all the process for him, getting him in with some other specialists and so forth. The CT scan, to answer your question, the CT scan is a special type of x-ray where it takes your body in multiple slices, sort of like a bread loaf being sliced up into multiple, what we call axial imaging. So it's cross-sectional imaging of every slab of your body from whatever portion you happen to x-ray. Mm-hmm. And it does it very fast. It runs you through a little scanner that's a kind of a donut-shaped machine, and it rapidly images with very good detail every part that's imaged in a cross-sectional way.
And from that, we noticed that I had a 10-centimeter tumor on my right kidney. We decided to get further tests. We went in then for a next step up, which was an MRI, to take additional imaging of that. And my tumor actually was a little more complex because it actually had grown into a vena cava, which is one of the main feeding sources into the kidneys. So it was a little bit more tricky than that. Dr. Hopkins could probably elaborate a little bit on that.
Well, actually, he had a special type of kidney cancer, and kidney cancer is a very unusual tumor for a lot of reasons because it can present in so many different ways. It's called the internist tumor because it can present with fever, it can present with anemia, it can present with high calcium levels, just a lot of bizarre things. These tumors make a lot of unusual hormones, and they cause a lot of different effects in the body. And one of the things that these tumors are also known to do is that they can invade the actual kidney vein, the main vein that comes out of the kidney to drain the kidney of its blood. And in that process, not only does it invade into the vein of the kidney, but it actually goes up to the next set of veins that it joins into, which is the main vein back to the heart, called the vena cava. So the vena cava is actually the main blood flow back to the heart. When that happens, and you get this, what we call a tumor thrombus, or a big clot of tumor growing up into the renal vein and then up the vena cava, it actually causes a lot of other symptoms, obstruction of blood flow back to the heart, and it's a very, very, it can be a very tricky tumor to deal with surgically. So not only did he have a metastatic, widely metastatic lung cancer, but he also had, in and of itself, the main tumor was a very difficult surgical challenge to deal with.
Right. So you're working at a place that deals with cancer all the time, and here you are, now you get the diagnosis, right?
Right.
And that was a stage 4?
It was stage 4, and I was told by the oncologist, I asked him how serious it was on a scale of 1 to 10. He says it's a 10 plus.
Oh,
I said, what does that mean? He says, I'd start to get your affairs in order. Statistically speaking, we're looking at anywhere from, 3 to 6 months.
In your head, what goes on when you hear that?
In the head, it's a little bit of a shock. It doesn't really sink in initially. You kind of hear it, but you're not really understanding what that means. And then once the full realization of what that means is, you've got some decisions to make. My initial decision was, I've had a good life. It's been good. I've got no complaints. I wasn't at a stage where I was why me or angry or any of that stuff. And then I started thinking a little bit more about it and thinking about my family and my friends and all that. And I said, I'm not quite ready to give in quite so easily. And I kind of adopted over this whole process kind of the 4A approach, and that is awareness. And that's to be aware of your body and any changes to your bodies and take action on those. I think it's assessing what your options are in regards to what it is. And I think probably the most important one is attitude. How are you going to approach this thing? And I think the best way is with the most positive attitude you can. And the fourth one was approach. What is the approach you're going to take to combat what you've got going on?
Mm-hmm. That probably happens after the initial shock and crying and, oh, my God.
Yeah, well, there wasn't really... In my case, there wasn't really a lot of tears on that. It was more, I felt bad for my family versus myself. Mm-hmm. I've got 2 girls and I've got a wife that I love very dearly, and to know what they would have to go through was more of my pain versus what I would have to go through.
Right.
John, I just want to add, John's, I think one of the things that's helped him so much is his attitude. He's been very positive in all this, and I think it's really translated to his current situation. I mean, he's doing well right now. We'll talk about that, but I think a lot of this is his attitude. He, and also just to add a little bit of background, he's an athlete. He came from, he played basketball in college, and he's a fighter, and so I think that competitive spirit in him, mm-hmm. Also helped with this process.
Well, not to sound new age, but they do say that your thoughts can affect the cells in your body.
Absolutely.
So I think there's something to that. Absolutely.
I'd like to think I'm living proof of that.
Yeah, absolutely. This is South Bay Sunday, and I am Sandy. With me today are Jon Jardine, stage 4 kidney cancer survivor, and his doctor also joining us, Brian Hopkins, doctor at Pacific Urology. Now, I know you did a lot of online research, correct?
Absolutely.
Do you think that online research is kind of a double-edged sword? Because if I have something that I think, I freak out, and then I'm paranoid, and everything online is like a death sentence to me.
I think on the balance, it's a good thing because patients come in more educated, but there's a lot of misinformation, and I think the very sophisticated person it's surprising how much they can learn, but the average person gets so much information. In some cases, it's confusing to them, but on the whole, I think it's more
helpful.
For me, I think so. I come from I practice in an area where there's just a tremendous amount of sophisticated people, and as a result, none of them have the attitude, just tell me what to do, doctor. It's always a lot of questions. You have to spend a lot of time with them, and for me personally, I like that challenge, and still feel that, on the balance, it's a good thing because they're more educated. They know what they're getting into.
Mm-hmm.
Well, and it's also very interesting, too. I've got 2 daughters. At the time, they were 24 and 27. And once they found out, they were on the Internet looking up the disease I had, what it was called, what the signs were, what the options were from the medication, from the surgery. And they were educating me, and I was looking online as well. The thing you have to be careful about is not to base too much credence in pure statistics, because statistics takes a wide variety of individuals from a wide variety of ranges that are out there. And if I went solely on statistical averages based on what I have, we wouldn't be having this conversation today. Working in the environment I worked in was, again, people always say things happen for a reason. I'm a firm believer of that. How I ended up at this particular practice to work with these particular physicians in this particular field and then be diagnosed with the disease that they were experts in, it still baffles me.
Very ironic.
Yeah, but I'm very happy it did happen. And, it educated me probably a lot quicker than maybe a normal person that didn't have access to these type of resources. Because Dr. Hopkins and Dr. Taylor and many of the other physicians that are part of our practice were very interested in my case and were able to advise me on certain things and what to be prepared for and what to expect. So it was very helpful.
So 2 years ago, you got your diagnosis?
It was actually a year and a half ago.
Year and a half ago. Okay, yeah. Wow. What a crazy last year and a half then.
Yeah, it has been.
I'm sure. Now, you had a great support system. Aside from, everyone you worked with, your family was good. And,
absolutely.
Yeah.
And, the amazing thing about this is, at least in my case, is you never realize how strong and how big a support system has until something as challenging as this comes out. I had some friends that were out there, and I've got acquaintances, and I got families, but everybody just came out in groves when they found out. And to the point where my wife would do a newsletter after every event and send it out to this huge distribution list. And that way it kept everybody informed, educated what was going on, the progress that was being made.
They can basically track everything you're going through online.
Exactly.
That's really nice. So tell me how, since your initial diagnosis, how have you changed as a person?
I changed more probably from an inner perspective. I have a different outlook in life. Not that I ever took a lot for granted, but I don't take anything for granted at this point. I want to try to enjoy life as much as possible because we never know. I mean, this stuff could take me tomorrow, next month, next year, 10 years from now. And I don't want to miss out on all the opportunities there are. My wife and I made a commitment that we're going to do something special each month, whether that be go to the city for dinner or go to Phoenix or go to wherever. We're just going to try and make the most out of the time we have together now because we don't know what that time period is.
Is it true then the saying, don't sweat the small stuff?
Absolutely. That is absolutely the case because things that would have pushed me over the edge 5 years ago, now I just take in stride and we just move along.
The thing that is very impressive to me is that you watch Jon go through what he's going through and it really helps you understand. I'm basically a surgeon and I deal with this all the time, but to see him fight through this and handle it the way he has is really inspiring. And the thing that is really amazing to me is that he is on a drug right now. A lot of new exciting research, and out of that research has come this particular drug that he is on. It's actually shrinking a lot of his tumors right now that he has left over in his lungs. His kidney tumor has been removed along with his kidney. The thing about the drug is that there's a lot of side effects, and he just gets on with his day and deals with it, doesn't complain, and he's got to be fatigued more than I am. I've been up on call all night, but he also has been on a drug that, fatigues the heck out of him. He gets certain side effects that he doesn't really complain of, and he just deals with it.
Before we wrap up today, is there anything you hope that just anyone could learn from your experience?
Yeah, and I think, not to give up on anything, not to succumb to what statistics say or to what you read on the internet. Everybody makes their own path and depends on the attitude that you have and the hope that you want to give towards it. But I think those have been very strong contributing factors to where I am today. And I know I'm not out of the woods. I know it's still a long road to hoe, but my quality of life is good. I'm enjoying life. I'm enjoying where I'm working. I'm enjoying, the time I have off. So I think it's all in the attitude that you bring to it.
The only thing I would add is that, don't ignore subtle changes that occur, any kind of unusual finding that you pay attention to your body, basically. And if you find something that's unusual or you're concerned, don't be in denial. Just go get it checked out. On the other hand, you don't want to be a hypochondriac, but there's a balance there where you do need to realize real changes. And if an initial doctor has an opinion that you don't really trust, just get a second opinion and then go
That's
from
so
there.
important with the second opinion.
Yes, exactly. And the other thing I'd like to add is that, some people are reluctant to get things checked out when in the back of their mind they really know there's a problem. And part of the reluctance is they're afraid of being diagnosed. But the thing is that there's so many great technologies out, laparoscopic surgery, for instance, minimally invasive approaches that I do. People recover quickly, and you shouldn't be afraid of those things. Robotic surgery, all of these things. And then the new novel drugs that are constantly coming out. I mean, John may be on another drug in, 6 months. That may be far better than what he's on now. It's a really exciting time in medicine, and patients should not be afraid to get diagnosed if they think there's truly a problem.
All right, pay attention to your body.
Yeah.
Right.
And use the information that's out there to educate yourself. I mean, the Internet's a great source. I mean, we have a website that has a lot of content on it that goes through everything that I've gone through and everything much more involved with urology.
So if people want to learn more about all this and new technologies and your story and everything, what website did you want them to go to?
Well, I would go to pacificurology.com, and that is a website that has a lot of content on it in regards to urological issues, including what I've gone through, kidney cancer as well. So it's a good reference source that's out there. It'll educate you. It'll bring some information. And if you did need to see a urologist, there, I got all of our locations and phone numbers on there as well.
Awesome. It's also where you work.
That's right.
PacificUrology.com. This has been South Bay Sunday, and I am Sandy, who spoke today with Jon Jardine, stage 4 kidney cancer survivor, and his awesome doctor, Brian Hopkins. Thank you both for being here today.
Thank you.
Thank you.